Dr. Wanda Dyson, founder and director of Change for Life Wellness and Aesthetics, located on Capitol Hill in Washington, D.C. Today's guest, Dr. Kian Karimi, is a world-renowned double board certified facial plastic surgeon as well as head and neck surgeon. He is considered one of the nation's top facial plastic surgeons and is an innovator in advanced surgical and non-surgical treatments. He is a recipient of multiple awards, including Outstanding Achievements in Facial Plastic Surgery and LA Magazine's Super Doctors. He has been featured on the CBS, The Doctors, and Extra. As medical director of Cosmo France, he has been part of research and development of PRF gel, an all-natural, 100% safe treatment to rejuvenate the face, which we will discuss today. It is my honor to welcome you, the esteemed Dr. Kian Karimi, to my show, Inner Health, Outer Beauty. Welcome,
Thank you,
Dr. Karimi.
Thank you so much, Dr. Dyson. I usually don't agree to do anything live except for my OnlyFans page, but I wanted to make a special exception for you. So thank you so much for inviting me to be on this.
Thank you for doing it. So for centuries, we've been looking for the fountain of youth. I think we might have found it in PRF gel. That question will be answered by the end of this show. I've been using PRF gel for facial rejuvenation in my practice for nearly 8 weeks, which is long enough for a lot of my patients to get 2 treatments. The results thus far are phenomenal. This therapy is 100% safe and contains no additives. It comes from your body and is as natural as you are. So today we will discuss these different treatments, PRP, PRF, and PRF gel. Some people in our listening audience know about PRP because of a celebrity whose name I will not mention, who plastered blood all over her face for a treatment and posted on social media. That was PRP. Can you tell me the difference between PRP, PRF, and PRF gel?
Absolutely. You're right. So PRP, or platelet-rich plasma, has become pretty much a household name. And PRP was actually first described by 2 dentists. One was actually a good friend of mine, he's an oral surgeon down in Florida, in 1998. And so PRP was kind of the first time that we recognized and gave platelets their due respect. Platelets were kind of just, for us in the medical field, they just form a clot and that's what they do. The platelet plug, that's kind of what we learned 20, 30 years ago. But platelets, as we've come to understand, contain these sacs of growth factors within their alpha granules. So if I were to injure myself or cut myself, platelets are the first cells to rush to the scene. Then they kind of form this matrix around the fibrin, and they start to release their growth factors slowly, which then brings together a host of growth factors and cell signalers to create new collagen, new blood vessels, etc. So these dentists in the late 90s said, well, what if we enrich these platelets, isolate them from blood, and make them platelet-rich plasma, or PRP? However, to do so, they had to put anticoagulant because they didn't want it to clot. And there were different types of systems with a buffy coat that had a little synthetic layer in the middle of the test tube to essentially separate the red blood cells and white blood cells, and you're left with platelets and also platelet-poor plasma, or a plasma component, or PPP. So PRP really became quite big, not just in dentistry, but in oral surgery, and eventually in plastic surgery, reconstructive surgery, orthopedic surgery, and aesthetics. And I actually personally used PRP for many years before wanting to find something better. And that's when PRF came along in 2016.
So what was the application of PRP in surgery and dentistry? Was it for wound healing?
Yes, so PRP, exactly right. So diabetic wounds, ulcers. I used PRP with fat grafting. There was a study from Ali Motorassi from Sweden showing the improved, from Switzerland, showing the improved uptake of fat grafts with PRP. It made a lot of sense. But PRP could not be used as a gel filler because it was liquid. It was stripped from its fibrin, so it would not clot. We utilized PRP after microneedling. Like you mentioned, there was a famous kind of microneedling facial that was branded and coined, has become, again, a household name in aesthetics and amongst the public. And so PRP had a lot of great applications post laser resurfacing, but PRP is great. But if you look at the studies in terms of the release of the growth factors, it's a flash. It's a one-time phenomenon. It's a pop. You get the growth factors, it spikes, and then it goes down. So there's no extended release. There's no like in vivo, we get that extended release, and there's no gelling of the PRP.
Are we talking about the release of the growth factors for like minutes or hours in PRP?
Minutes.
Okay.
Yes.
So there's a difference as we go from PRP, PRF, and now PRF gel. So PRF gel is top of the line.
That's right. That's right.
So what is the difference? PRP is just a flash of growth factors. PRF, a little longer release of the growth factors. And then PRF gel, we're talking about a much longer period. So what would be the differences in those?
So to understand PRF gel, let me first explain PRF, or platelet-rich fibrin, because again, with all the acronyms and nomenclature, it can get confusing. So in 2016, under my task with the medical director of Cosmo France, I'm always looking at different modalities that can improve the process. And although I was satisfied with PRP, I had come to learn that the oral and maxillofacial surgery world were using these PRF gels to basically put together bone grafts and rebuild jaws. I mean, I was absolutely blown away. I said, how can something be so powerful and be so effective, and why are we not using it in aesthetics? So I really did a deep dive in 2015 studying PRF. How do you make PRF? What's the difference between PRF? And it's really simple. So when we create autologous blood platelet therapies, which is what this all is under the umbrella of PRP and PRF.
For lay people, autologous means from self. So it's from your own body. We have to be careful with our scientific terms. We're talking about to people that know nothing of these terms. PRP, PRF, it's like Greek to them.
Fair enough. Well, thank you for reminding me of the audience. I just wanted to sound really smart, so I'll explain things in English.
So we gotta break it down a little bit.
You know what's funny though is that it's confusing even for doctors. It's confusing for healthcare professionals. So it is really important to understand the concepts, and then you can get into the weeds of the technicalities. And so this is what I was trying to do. I didn't understand the difference between PRP and PRF. And the biggest difference, there's two big differences really to take away. Number one is that PRF is 100% natural. There are no additives, there are no chemicals, no substances, so you're really harnessing the power of your own blood. That was very attractive for me, for my patients, especially here in Los Angeles, but really all around the country and around the world. That's a very attractive thing, because a lot of folks and people watching this show right now are curious about aesthetics, but they wouldn't consider a toxin in their face. They wouldn't consider a synthetic filler in their face or in their body or anything else, but they would consider something that's totally from their bodies, which is, again, that was the number one appeal. The second biggest attractive component for PRF, for me, compared to PRP, was the fact that the benefits that you get from these platelets, from these cells, is over 1 week, over several days, rather than just a few minutes, like with PRP. So, like, if you ever heard of an extended release pill, so a pill that kind of slowly acts, PRF is basically an extended release PRP. So that was advantage number two. Then the third advantage, which really segues into PRF gel, is the fact that PRF, when you first make PRF, it's a gel. It's a liquid. It's a liquid. When you inject it into the body, it becomes a gel. So, this is where the kind of light bulb moment came on, because PRP in the past, the one that was made in the 90s, if you were to inject it in someone's face, the the effects of that injection, the volumization, go away within minutes to hours. With PRF, just regular PRF, it would gel in vivo, meaning in the body. And so that was really cool because then we could use it by itself. We could mix it with fillers if we wanted to buffer the filler a little bit and make it a little bit smoother, a little bit silkier. And so that was really appealing. But Doc, the biggest downside for that, we had a lot of patients saying, we love the fact that we can use our blood platelets to create a gel. We can have 100% natural filler.
So you decided to go a step further and create PRF gel.
That's right. That's
so
right.
That can be used as a filler, and you absolutely can have no objection to it whatsoever. And it doesn't make you look overly done or, as they say, Holly weird.
Is that what they're saying about us over there in the East Coast?
That's what they're saying about you. But whose idea? I mean, how did it go from being used for dentistry? Whose idea was it to, let's put it in the face and see what happens to rejuvenate the face?
Well, I can't take full credit for it. There are a lot of other really smart folks out there that were utilizing it in that capacity. I probably was the one pushing it the most in terms of in my own practice. My patients really wanted that. And I also did, a lot of the studies and the research looking at different protocols of, how fast to spin the PRF. There's been a lot of publications. The one thing I want to drive home here is that this is not something experimental. This is not something questionable by the FDA or by anything. This is like really pure hard science. I mean, there are countless, hundreds and hundreds of scientific papers published about PRF. PRF gel, however, was my response to patients asking me, how can we make this last longer without mixing it with anything synthetic? So we, again, dove back into the science. And it's so amazing. Like, medicine over the last 50 years has obviously progressed so much. Just when we think we know something about ourselves, about our bodies, someone discovers something and it totally changes our perspective. And PRF gel was one of those moments because we started looking at what else is in blood. It's not just plasma, white blood cells, red blood cells, platelets, kind of like, what you learn in science class in like 3rd grade, right? So PRF gel was looking at, well, what if we play with temperatures to cause some proteins to unfold, i.e. albumin. So albumin people may or may not have heard of, but albumin is the most abundant protein in our blood. It's the most abundant protein. So albumin, when it's subjected to heat, and they looked at this in the 60s, okay, when it's subjected to heat, it starts to unfold. Okay, they weren't looking at PRF gel, but they were just looking at albumin as a new protein that was discovered in our bodies. It starts to unfold and create a bigger surface area, and it creates another scaffolding. So with PRF gel, that's essentially what we're doing. We're still drawing blood. We're not adding any additives, so it's still 100% natural. Then we're heating and cooling. Okay, so we're heating one tube, we're cooling another tube, mixing it together. And what we have found is that you get this beautiful gel that you can push. It feels like a filler and behaves like a filler. The big actively looking at ways to get the gel to last longer, as long as we never compromise on the fact of it being 100% natural. So that's really what we're looking at.
Well, in my patients, I found that PRF alone, which I started using before PRF gel, that it was lasting up to 2 years. And one of my patients whose husband is 4 years older than her, people think she's 20 years younger than he is.
Right.
So I've been getting like really fantastic results with PRF, but PRF gel, it's like a whole nother level. And I've been putting it everywhere. I've been putting it under the eyes, in the cheeks, in the lips, in the smile lines, jawline, everywhere. And the lower third of the face, which is hard to inject. Absolutely. And it's been absolutely fabulous. My patients have a glow.
Yes. So again, as medical director and as an educator, as someone who has a multi-specialty show, I'm always very careful about claims that I make about anything. Anecdotally, I've heard of docs like yourself having their patients enjoy, or themselves enjoy, the benefits of PRF for much longer, depending on the quality of their blood, their lifestyle, their metabolism, their diet, etc. And so we're trying to sort through all of those different things to understand the longevity. When you look at fillers on the market, names you've heard of like Juvederm, Restylane, etc., they look at studies to look at the effect, the clinical effect of those gels. And we used to think that the gel would last a year or a year and a half or whatever they told us on the label, and that it would go away. Well, lo and behold, we have learned that sometimes it never goes away. The body stops recognizing it as a foreign material. And I believe that it could probably be the case with PRF and PRF gel. But I would far rather have my own platelets as a gel to volumize an area, such as a sensitive area like the under eyes, which is one of the trickiest areas to treat as practitioners. I would rather it be something from my own body, i.e. PRF or PRF gel, than a synthetic filler, if it's going to stick around forever.
Right, right. Okay, so as we age, we lose collagen, we lose elastin, we lose fat, we lose muscle, and bone. PRF gel is purported to help regenerate those different aspects that we're losing as aging. Are you finding that it regenerates collagen, possibly the fat pads, and even possibly bone?
I want to qualify your statement, first of all, by saying that not everybody suffers from all those losses with aging. You have proven that age ain't nothing but a number, but I won't. But you're right. Most of us suffer from all those things that you said: bony loss, fat loss, drooping of fat compartments, loss of tissue collagen, loss of tissue elastin. Everything you said was spot on. So again, platelets are one component of keeping our skin, our bodies, our tissues healthy. And the platelets, again, because of those growth factors that they carry, they're not just emergency responders. They're actually integral parts of our vitality and of our youth. And PRF and PRF gel is really starting to tap into their power.
To schedule your PRF gel consultation with Dr. Dyson, call 202-575-4660 or visit cflwellness.com.
Okay. I understand from reading, I think it was in your article, that PRF gel could also be used for brow stimulation. Can it be used on the neck as well? Because we don't like crepey necks as we get older. And perhaps the décolleté has it been used there as well?
Yes. So PRF has been shown to improve hair growth and hair stimulation for sure. So we've used it for brows, we've used it for the scalp. And in terms of rejuvenating crepey necks and décolletages, we're doing that all the time. We're injecting PRF under the skin, okay? And you can inject PRF within the skin.
The gel or regular PRF? Can we use the gel?
Okay, so the gel, the only time that you need to use the gel is when you want to use it as a filler, when you want to volumize, when you want to restore something that's lost. Because it doesn't have, in my opinion, it doesn't have any additional benefits from the platelets other than the fact that the gel may stick as a gel form for a longer period of time. And so that's where I think the gel comes into play for now. That's my understanding for now. I may, depending on what the science shows and what the study shows, I may in a year from now when we're doing this be like, you know what, use PRF gel for everything, because there are additional benefits that we're not seeing with regular PRF. But when I'm injecting things to stimulate collagen under the neck, I'm using, right now I'm just using PRF. PRF gel is when I'm doing under eyes, I'm doing temples, I'm creating volume for someone who either just wants to look better or wants to look less tired, or someone that suffered from trauma, from cancer reconstruction, from a scar. I mean, I've seen some incredible results with PRF gel in those folks, because I want those to be permanent results.
So, but potentially PRF gel may be more dilute so it doesn't volumize, might be good for the neck and other areas because of the growth factors lasting longer. So we might get better results in those areas. I might just try that out on myself.
Yeah, I again, without science to back that up, I won't make that claim. I do think that it is, I think it's a good idea. So I think it's something that we continue to look at as we compare PRF gel. I mean, you've been using it for 2 months. We've only developed this, over a year, a little over a year, and we've been really careful in our rollout because I want to position it right in aesthetic practices so that aesthetic physicians and providers such as us can really, offer the best of what it can offer to our patients.
Well, so far for me is fabulous. Other than bruising and perhaps redness, are there any other side effects from injecting PRF gel?
Yeah, the biggest side effect I would say is swelling. And so the eyes are very, very delicate. So regardless, whether you inject just saline, which is salt water, or a gel filler, or PRF gel, that's the biggest reaction that I've seen is swelling. So when I've injected the PRF gel and done 10, 11, 12 syringes, which is still, for those of you listening on that, that's still less than a tablespoon of product. A tablespoon is 15 milliliters. So but a little can go a long way when you know what you're doing and when you know where to put it. But I've had some patients the next day kind of have some swelling reactions, but that swelling usually only lasts about 1 or 2 days. In terms of anything dangerous, I'm very happy to report that since 2016, where PRF was first released, there's never been a reported case of tissue dying from injecting into a blood vessel, something in our community we call a vascular occlusion leading to necrosis. So that tells me that I believe that as injectors, and this is a little bit beyond the scope of our talk today, Doc, but I believe that we're injecting into vessels more than we realize. But our hemodynamic system, our blood pressure, our mechanisms to clean up the mess for us. And so one of the things that folks listening to this may or may not know is that when you have synthetic fillers injected into your face or into your body, there's a chance that tissue can die. And we call that necrosis in the scientific field, which is a terrifying complication. And even worse, it can cause visual compromise, cerebrovascular compromise, etc. All that being said, those are all very rare complications that happen. But it's really exciting that with autologous therapies, it makes sense. Like the platelets are coming from you, and even though we're making them into a gel, we're not actually chemically modifying it in any fashion. We're simply utilizing our own material to kind of put it back in a different context. And so thus far in 6 years has not led to any of the devastating complications that synthetic fillers can cause.
And also injecting fillers for like the sunken areas beneath the eyes, that I read can be a problem, that it can track beneath the eyeball.
Yes.
Is that a potential problem with PRF gel, since we're injecting something that's very natural? It's just you.
Right. So if you put PRF gel into the wrong place, it could cause a problem, right? If you inject it into someone's brain, it's probably not going to help them out very much. If you inject it into the eyeball, or into the orbit, as we call it, so the area under the eyeball, but beyond where we want to volumize, it probably won't cause as much trouble as a synthetic filler. That being said, just because this technology is out there, you got to have the person who knows what they're doing injecting it. Just because you have a fighter jet doesn't mean anybody can jump into the cockpit and fly, right? And so we do have a fighter jet. We have an aesthetic fighter jet at our disposal, and as the pilots, it is up to us to maneuver that jet appropriately.
Yeah, we need to act responsibly.
Yeah.
Are there any patients, or would there be any patients that PRF gel wouldn't work in? You mentioned that certain things can affect it, like lifestyle, I guess, if they're a smoker or whatever else. Are there patients that you would say really aren't candidates for PRF gel?
So so that's actually a really good question, and I've had to answer that question many, many times, being the medical director for the company, and my answer is typically the same. So if someone has some dysfunction of their platelets, so some people have bleeding disorders where their platelets don't clot enough. Some people have bleeding disorders where their platelets clot too well, and then there's everything in between. I have never said that the patient could not still utilize platelet therapy in that capacity. Because if they have a bleeding issue, it's going to be far riskier for them to have a synthetic filler or something more major than to have their own blood platelets. And so, I call these relative contraindications, meaning that you need to proceed with caution. It's a yellow light, but it's not a red light. In terms of red light conditions for this, I really don't see any, because again, it is utilizing our own blood without adding anything synthetic to be used. So even if you have some kind of blood disorder, now of course, if you have an active infection, if you have active cancer, or something of that fashion where your body is fighting, a battle, then you don't want to add to that, right? So those are absolute contraindications for everything that we do. Okay, but in terms of someone who is otherwise, functioning adult, that just happens to have, autoimmune issues or some blood platelet disorder or bleeding disorder, then I still think that the PRF and PRF gel can be utilized safely, but with caution.
Are there any medications that might interfere with PRF gel working?
So there are some medications that we take that will prevent the platelets from clotting. So if someone is on one of these blood thinners, as we call them, or if they have a disorder where their platelets don't stick together like other people's platelets do, then they can still enjoy the extended release of the PRF, but the PRF is probably not going to stick around as a gel or as a volumizer. So they can still benefit to some degree, but they probably won't be able to benefit to the same degree that someone would if they weren't on a blood thinner or did not have some kind of blood disorder.
What do you tell your patients that are coming to get PRF gel in terms of preparation? How do you tell them to prepare?
So we have patients go on a relative low sugar diet. So to really lower the amount of sugar, so that includes simple carbohydrates, and things that are going to kind of make the plasma component more polluted, so to speak. And it's so interesting, Doc, and you've probably seen this as well, that when you draw and create PRF from different folks, you can kind of tell their lifestyle from their plasma. I've seen folks that have like really thick kind of yellow white, almost looks like fat, and these are folks with high triglycerides, high meat in their diet, etc. And so we'll have them do low sugar. We'll have them be very hydrated when they come into the office, especially men, because men, we have higher, on average, we have higher concentrations of red blood cells, and so it's harder to get and make PRF in us. That's one thing. Folks that are on hormone replacement therapy, we've actually found that the PRF will clot a little faster, and so that's just something to keep in mind when we're doing these types of treatments. And so, yeah, just being relatively healthy, I think, is the key. But just like when you asked me before, if somebody is on a medication that they can't stop, because of a medical condition, or if they have a pre-existing condition, doesn't mean that they can't use the blood platelets. It simply means that they may not enjoy all of the benefits of the platelets that someone without that condition or without that medication would enjoy.
I find that in different patients, there's a different yield. Some people get like a lot and some people very little. And it doesn't seem to have anything to do with age or gender. So
Right.
How do you explain that?
So that's probably their hydration level. And there are some clinics that are actually pre-hydrating patients with an IV before getting their PRF, which is a great idea. If you have folks that we're all generally pretty dehydrated. I'm dehydrated right now because I was in the OR this morning. And so, and folks that travel, just flying on a plane will dehydrate you because of the pressure changes. They don't give you any water on these damn airlines anymore. So, we're all chronically dehydrated.
Right. So I think we're coming down to the wire. Um, PRF gel treatments are recommended, two treatments 6 weeks apart. Why is that?
So it's right now I have that to give me a buffer because I don't know how much is going to stick around. I don't know how much swelling the patient's going to have or what they can tolerate. I mean, here in LA, people expect a treatment and they expect to be able to go to lunch or to dinner without any visible signs. And I think that's happening everywhere because it's like we come in with a magic wand. So it gives me 2 attempts to really create a gel that's going to have the effect that we want it to do, whether it be under eye circles, volumizing the cheeks, the lips, improving the skin quality, making hair grow, whatever it is that we want to do. It gives me 2 shots to do that because sometimes the patient comes in for the second time and they're perfect. Like I don't have to do an additional round, but I have some patients who are, exercise fanatics, fast metabolizers, or they were dehydrated the first time. Have them come in, we have a second shot at it. And this makes folks feel really comfortable that I don't try to overshoot the first time and they have to walk around looking swollen or be one of these rare folks that retain everything that we inject into their face.
Is it possible, like I told you, I did a patient that has HIV lipodystrophy, which is loss of fat in the face. He's pretty gaunt, like it's almost just skin on bone. Is it possible that in a patient such as that they might need even more than 2 treatments? Could it be 3 or even 4 treatments in a patient such as that one?
Definitely. I mean, even if we did fat grafting in a patient like that, it usually takes more than 1 round. And certainly for just PRF or PRF gel, it may require multiple treatments. And so just setting that expectation, setting that concept, I think is frankly, my patients really like it because it shows that we're going about things sensibly. We're not just trying to pump them full of their platelets, and we kind of see how they respond the first time. Now, once we get a sense in terms of how they respond, then we modify accordingly. I say, okay, you know what? You took up the platelets, great. You need to see me twice a year for this. Or you know what? It didn't really take that well. Let's do a second round and see how it goes. And you might need to see me every 3 months, every 4 months to maintain the results. And so that's, it's a case-by-case basis.
Great. Can it be used in the beard area to
For hair
rejuvenate?
growth?
Yes.
Oh,
PRF
absolutely.
gel.
Yes,
Okay.
so PRF gel and PRF are phenomenal for hair growth. You have to have a follicle there, of course. There has to be the hair follicle. If the hair follicle is gone, then it'll only stimulate the hair that's around the area that doesn't have hair. But if there is a little hair follicle, if someone's thinning, or if they have just thinning small hairs, then it'll actually make the hair thicker and more robust.
So, other than what we've already spoken about, I think the only reason that someone wouldn't get PRF gel is if they're actually afraid of needles or getting their blood drawn, or they're afraid of blood. Other
Right.
than that, there are not too many reasons that a person would not benefit or couldn't get PRF gel. Would you agree?
I would agree with that, and I think if someone was ever hesitant to have an aesthetic procedure done, they're usually hesitant for a few different reasons. The number one reason is they want to look normal. They want to look natural. They want to look like themselves. And PRF gel is perfect for that because it is utilizing your own tissue to basically just restore what was lost or to plump the skin, make the skin a little bit thicker, more vibrant. The second reason why people fear, or not a fear, but a barrier, is cost. And so people want to invest their money into something that is going to be of value, that's going to last well for them, and is going to accomplish what they want to accomplish. I don't know about your practice, but in my practice, PRF gel does cost less than other modalities that I offer, i.e. surgery, fat transfer, and so the accessibility of this is far greater for the general public because we're not talking tens of thousands of dollars here. We're depending on your needs, it could be hundreds of dollars to maybe in the low thousand type of ballpark. And again, it depends on what your needs are, how many times you have to do it, etc. But that also really creates an access point for patients. And then the third thing is, this is for the extra savvy consumer, what can go wrong? Very few people think about what can go wrong. And there's complications to everything that we do. But when you look at all the aesthetic treatments on the market in 2022, I would argue that PRF and PRF gel are two of the safest, if not the safest, treatment that we could do.
Actually, that's great. That's a great reason to do it. I also read in one of your articles, and then I'll close out after this question, is that using the PRF gel along with fillers will actually extend the benefits of the fillers in terms of the collagen stimulation.
Yes. Yes, so we actually have found that to be the case. And when we were first just using PRF, I was playing with the different concentrations of how much to add to the fillers to extend the longevity of the fillers. And what I found was that the fillers are gels that are synthetic gels. They're made gels. They're not natural gels. But when you add something natural and you buffer it and you kind of expand the particles of the gel to disperse in a larger area in a smoother fashion, you have far less issues with lumpiness, nodules, clumpiness, and it really creates like an awesome kind of buffer for those gels. So that's a real big benefit to that.
So which type of fillers would you combine PRF gel with? Just hyaluronic acid fillers? Would you use it in combination with other so-called biostimulator fillers such as Radiesse and Sculptra?
Yes, so we routinely use PRF and mix it with Radiesse and Sculptra. And so you can mix PRF with anything you like. I mix it with fat when I do fat grafting, with or without a facelift. I mix it with regular hyaluronic acid fillers like Restylane and Juvederm. We mix it with Radiesse when we're doing, under the neck, for example, hyperdiluted Radiesse with PRF. And you can actually mix it with Sculptra as well. So it really can add an additional boost to whatever treatment you're doing.
Awesome. Well, this has been very helpful for both professionals and lay people, because I've been trying to explain what PRF gel is to some of my counterparts here in DC. And I told them that we'll have this show and they'll be able to look at it and understand what we're doing. And I want to thank you very much for taking time out of your busy schedule to come onto my show. And anyone that wants to know more about Dr. Karimi, because his achievements were this long, can go on drkiankarimi.com. Thanks again, Dr. Karimi, and see you soon.
Thank you, Dr. Dyson. This was my pleasure.
To schedule your PRF gel consultation with Dr. Dyson, call 202-575-4660 or visit cflwellness.com.